Hello everyone, I'm Dr. Angela Mattke and you're watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. I'm a pediatrician at Mayo Clinic Children's Center, and twice per month I host a show about pediatric health topics where we take and answer your questions live. Today we will be discussing vaping and e-cigarette use among today's youth and the health risks that are associated with it. We are fortunate to have two guests joining us today. The first is Dr. Jon Ebbert, an expert in nicotine addiction and also the medical director of the Inhaled Particle Aerosol Lab and associate director of the Mayo Clinic Nicotine Dependence Center. The second guest is Dr. Sophia Pillia, a pediatric pulmonologist at Mayo Clinic Children's Center. It's going to be a great discussion today. Hopefully you'll have lots of questions, so please send them under the Facebook Live video feed and we will try our best to review them during the live broadcast today. So Dr. Ebbert, thank you so much for joining us, and Dr. Pillia.
Pleasure to be here.
It's wonderful to be here. We were just talking before we got started that you've been working in this area for a long time about harm reduction and about the effects of nicotine. Is that correct?
Yeah, for about 20 years.
And you've been working more recently or in the last decade or so about e-cigarettes. Is that correct?
Correct.
Okay, so it's going to be great to have you here to talk about the effects that we are seeing and the prevalence, how it's increased among today's youth. Let's get started by talking about, really how long have the e-cigarettes and vaping devices been around? Because it seems like we've really been hearing a lot about it in the last year.
Right.
But I think they've been around longer.
Correct.
Okay.
They entered the U.S. market in 2006. About 95% of all electronic cigarettes are produced in China. And indeed, those were the first ones imported into the United States. There were legal battles about whether it was going to be regulated as a medical device or a tobacco product. And the reason why you've seen such a rapid expansion of consumption is it was regulated as a tobacco product, which is essentially really loosely regulated.
Okay.
So that's why we've seen the the widespread uptake of these products.
Okay. Now, the prevalence of people using these e-cigarette and vaping devices has really changed in regards to how they are consuming nicotine. Can you talk a little bit more about that?
Yeah, so these products deliver nicotine. I would say that when we look at conventional tobacco products, so nothing delivers nicotine more readily or quickly than the smoked conventional tobacco cigarette. And the addictiveness of any chemical is directly related to how quickly you can get it into the central nervous system and what concentration. So the conventional tobacco cigarette is precisely engineered to deliver nicotine very quickly. Now, these devices were thought to be something that could potentially replace conventional tobacco, but they don't deliver nicotine as well, even in some of the more advanced generations today. So they both deliver nicotine, but there are important differences between the two. One key difference is that when you smoke a conventional cigarette, you burn it at 1,000 degrees. These heat at 350 degrees. So it's a very different chemical process, and it creates a very different chemical result.
Okay. Amongst today's youth, has there been a shift amongst e-cigarette use as opposed to conventional cigarettes?
Yeah, it's been striking. So I think as long as the CDC has been tracking these numbers, we see that about 3 years ago, the consumption, self-reported consumption of electronic cigarettes exceeds the self-reported consumption of smoked conventional tobacco.
And we have a graph about this. Let's pull that up and we can discuss a little further.
Yeah, so this is current use, and you can see they'll track any product. You can see e-cigarettes almost are 3 times as high as conventional cigarettes, and I think that's when we realized 2 or 3 years ago, when we saw that shift, that's when we began to realize that this is a serious problem. Now, the concern is, obviously, for kids who have never used conventional cigarettes, that e-cigarettes potentially serve as a gateway to conventional cigarettes. And that's why this is alarming.
Yeah, absolutely. And the numbers over the last couple of years have dramatically increased the number of teens who have used an e-cigarette in the last 30 days. Is that correct?
Yes,
amongst
correct.
the surveys that we're doing.
Yeah.
And so I think it's surprising to parents, and a lot of parents don't realize it, but their kids are using these. They are being exposed to them at school, and they're being used during school hours.
Correct. I think they're easy to conceal. As we look about and think about at the different products, some of the products produce a lot of aerosol that's very visible. Some of the products produce very little aerosol, such as I don't know if we're supposed to talk about products, but the pod devices produce very little aerosol. In fact, you can go online and you can read on these websites, and they teach kids how to actually have zero aerosol vaping. So producing no vapor so that they can conceal the use and use them in school.
Okay. Well, how do these actually work? And I think we have a graph to kind of help demonstrate this.
So the nice thing is that I'm a simple person, and I like to keep things pretty simple.
Me too.
And the fact that there are so many different products that I have out in front of me here, but as we look at this graph, it's basic. They're all the basic construct of a heating element in the middle, a battery that drives the heating element, and a heating element that's in contact with some liquid that is aerosolized when that heating element's turned on. And that's it. It's just that simple. Everything is a variation on that design.
Okay. Well, we have some pictures of some of them, and there's been an evolution since they first came on the market back in, you said 2006? Is that
Correct.
around the time?
Yep.
And so let's kind of go through that, and then we'll share what some of them look like so parents know what to watch for.
So it's interesting. We talk about e-cigarettes, but none of the things in front of me, or very few of the things in front of me, and very few of the things on this graph actually look like a cigarette.
You're right.
So they were, but that e-cigarette terminology has actually stuck. And the reason I have N's up there is because a better descriptor in the current environment is that these are actually electronic nicotine delivery systems. And the system consists of a battery, the heating element, and then the liquid. So as you look at N's evolution, the first products actually coming from China look very much like a cigarette. And actually the first company in China was named Ruyan. Ruyan actually means to resemble smoking. And so that was really what it was. It was actually, the first electronic cigarette was developed by a Chinese man called Han Lik. He was a pharmacist and his father died of lung cancer. And he thought there must be a better way. So he developed the system with a heating element. And as you go from left to right here, you can see they started out with e-cigarettes and they became rechargeable. Then they developed open tank systems. An open tank system is essentially a system that you can refill. You can buy your own e-liquids, open up the tank, put more e-liquids in, and continue to aerosolize the e-liquid. And then they have closed tank systems where you can't refill it, and then they have what they call box modulars. And another way to categorize them is really first generation, second generation, third generation. What's important to remember is that the reason why this is important and interesting is that as the products have advanced, nicotine delivery has increased.
And why is that?
So it's really probably a combination of two factors. Number one, we know that particle size is very important for pulmonary delivery, and that when you start to aerosolize at different temperatures, you aerosolize using different heating elements, aerosolizing using different metals heating elements, you create different particle sizes. And also e-liquids actually have evolved significantly. Can we talk about brand names?
Yeah, I think so.
Okay.
Everyone knows what they are, otherwise parents won't know what to look for.
So Juul invented the nicotine salt, and the nicotine salt allowed the taste of the nicotine to be much better at much higher nicotine concentrations. So they actually really broke the glass ceiling of nicotine delivery through aerosolization by making it a salt. If you aerosolize that much nicotine in a non-salt form, and it gets into some sophisticated chemistry, but in a non-salt form, it would be intolerable to the palate. I mean, nicotine's a poison, right? Tobacco plants make nicotine to protect themselves from bugs. And we actually consume nicotine, and we we actually have reinforcement from the drug nicotine, because that nicotine molecule looks exactly like a native neurotransmitter that we make in our brain called acetylcholine. And acetylcholine is actually involved in reward. So when we do something that rewards behavior, nicotine actually uses and hijacks that same reward system. So if you get a lot of nicotine in there, you get a lot of reward. And so what Juul did is they increased the nicotine delivery with the salt. And so that salt plus new metals and devices and atomizers really has significantly increased nicotine delivery, which is part of the danger, is that these kids are incredibly hooked. Very high levels, very high concentrations of nicotine, which makes it hard to quit.
Absolutely. Well, let's look at some of the pictures we have up of the different generations. Okay, so here's the e-cigs, which most people aren't using anymore. Is that correct?
Yeah, so you don't see a lot of those. You know, you'll see these actually in cigarette smokers that want to quit, who like to actually have something that looks like a cigarette.
And then the next one is the pen.
So this is a vape pen. I have that one in front of me. The vape pen really is just a straight, it's a straight on-off button. You have to hold it down typically. The vape pen provide a lot of power, lots of aerosol is produced. That lower right-hand corner is one that you can buy at one of the local, Walgreens stores. So they actually have, it's called the Logic, and it's a vape pen with those refillable cartridges. So they come in different forms. Pod systems. Obviously, the market was transformed with pod systems. The thing that's important, the unique differentiator of the pod systems is that the system, the pod, the heating element that contains the e-liquid only fits on the device that that company sells. So, for example, in the lower right-hand corner, you see a Juul type device. Juul probably loses money on the battery, but then, of course, they have a markup of 400% on the pod systems, and they make a lot of money by having a closed system pod, but it only fits on their device typically. Some of the pod systems are refillable, and some are not. This is a typical mod system. So mod comes from modification, and modification means you can add different atomizers. So the atomizer is the top part. The atomizer is the part where there's the heating element and the little reservoir, the glass there for e-liquid. And the mod systems help you modify these devices. On the upper right-hand corner, you can see what they call a 510 connector. A 510 connector is a universal connector that allows you to take any atomizer and put it on any device that has a 510 connector so they can be modified. Once again, the pod systems, I just want to show you with this picture that some of the pods are refillable, but in the lower right-hand corner, when people buy these pod systems, they can come in a package of 4 on the top there, non-refillable. They usually work with a micro USB that can recharge that lithium battery that's next to that bottle. And they actually have a system of blanks. So the blank actually you can refill with your own e-liquid, and you need that little bottle with that pin insertion on the top so you can actually use that little liquid bottle, fill it with your own e-juice, and then you can refill those cartridges. That's a typical kit.
Wow, that's fascinating.
Yeah.
And you have some of them here in front of you too. So
I do.
You can see how small some of them are and how it would be so easy to conceal them as well. But some of them are really heavy. Like some of these are really heavy, and so when we think, so one of the things that, and once again, I'm a simple person, I think about who are the users and what is the experience they're looking for. So on some of these systems, here's the atomizer. The atomizer comes off like this, and you fill this with e-liquid. This is called a Hell Beast atomizer, and then it has that 510 connector, and so you can take this and put this on here, and you can buy new atomizers. This has a large coil. This has a large vertically oriented coil inside this atomizer that is designed to make lots of aerosol. Very different experience than the typical Juul type device or a pod system that has a very small coil and makes very low levels of aerosol, but delivers a ton of nicotine. And why is that important? Because the liquid that you would put in this with lots of aerosol is very different than the liquid you would put in this. If you put an e-liquid for a device that is a pod device in here, you would become very quickly nicotine toxic. So it's 2 different behaviors using 2 different e-liquids. Mod systems and pod systems are really what most people are using currently in the market. Okay. So we've talked about nicotine as an e-liquid. Are there any other things that people can put in these systems, other liquids that they can use?
So essentially any drug that you can aerosolize, you can put in any of these systems that you can refill. So when you look at what's actually put in these systems, so in a pod, there's really 4 ingredients. One is propylene glycol, which is a food additive. One is vegetable glycerin. One is nicotine, and then the 4th is like a flavoring agent of some kind, whatever the flavor may be. And you can put nicotine in there. You can also put things like CBD oil in there. You can put tetrahydrocannabinol or THC oil in there, and you can aerosolize those particular elements in this as well.
So the tetrahydrocannabinol, the THC, is something that's been getting a lot of press recently. So as of December of 2019, there's been 54 deaths related to vaping-related lung injuries. So we want to talk a little bit about that. Do we know per se what the actual cause of these deaths were?
So unfortunately, no. We are yet to identify a definitive cause which causes these symptoms, and in certain cases death in these young adults and teens. But what we know is, like when we actually studied the lung fluid of these patients, we found a significant amount of vitamin E acetate and THC. What we also know is, that definitely it's not related to infection. But what we don't know is what is the role of the other contributors like THC and the other additional products, as Dr. Ebbert was mentioning. So that's where we are at this point. We don't have an answer.
That's right, we don't.
Okay. And a lot of these e-liquids, so people can purchase them in stores, but they also can purchase them on the black market, right? And so if they're being purchased by people where it's not in a regulated sort of market, we don't necessarily know what goes into them. Is that correct?
Right. So the FDA, I think, is trying to engage at a higher level under the Trump administration. They've changed the flavorings that you can put in pods. They have a tobacco 21 law now that you can't purchase even e-cigarettes unless you're 21. So there is a regulatory framework that's trying to be implemented, but really unregulated. You don't really have a clear idea. There are some deadlines that companies that want to keep e-liquids on the market have to submit ingredients to the FDA to stay on the market. So there is a regulatory framework, and but regulation without enforcement is essentially no regulation. So they need to start enforcing it, and I think they're trying to.
Okay. Now, has the Tobacco 21 becoming in effect already, or when will that go into effect?
It was in December it came into effect. So that is the law of the land. So Tobacco 21 is e-cigarettes, any tobacco products, you have to be 21 to purchase.
Okay, where are most of the teens that are under 21 purchasing these products at?
I have no clue, but I think at least from reports it says that most of these, at least young kids, they who don't have access to online, they actually get it from illicit sources and then close family members. And I think probably Dr. Ebbert can add.
So that's right. So what we see is that, so the reason why, so some people believe that the true effect of Tobacco 21, and they modeled it, like what would be the impact on population health if we kept it at 18, what would it be with 21, what would it be at 25, what makes most sense to change. Actually, what they think is that the reason why there is such high prevalence in high schools is they get it from other people who are of legal age to purchase. So the 18-year age and older cohort can still be in high school and purchase the products. By shifting it to 21, there's almost 0% of 21-year-olds still in high school. And so by pushing that cohort out, you are actually going to protect that cohort that's under the age of 18 in the high schools from getting them from those sources. And also, have you ever tried to purchase these online? I purchase these things all the time because I study them.
Right, absolutely.
You just have to click, are you 21 or older? And it says yes.
Wow.
And then you get in and you can use a credit card. Wow. It's very simple. Yeah. And then you get them delivered to your house within a day.
Okay, interesting.
Yeah.
Well, let's go through some common myths about vaping and e-cigarettes. One of the things that people say often is that vaping is safer than traditional cigarettes. Is that true?
What would you say?
I would say no. As a pediatrician, as a mom, and a pediatric pulmonologist, none of these things are safer.
Absolutely.
So I think that where that number comes from. So what you hear, so what's interesting is the National Health Service in the United Kingdom actually recommends electronic cigarettes to patients who quit smoking. So it depends upon what side of the pole you're on. Here, the U.S. Preventive Services Task Force does not recommend them. And when you talk about 95%, so the statistic that the National Health Service in the UK had actually used with that they're 95% safer. So where does that come from? So essentially what they did was they looked at all of the 4,000 chemicals that are produced by a conventional cigarette when it's burned at 1,000 degrees Celsius. All those chemicals in terms of their quantity and number, and compared that to the chemical quantity and number produced by aerosolization of an e-liquid. And if you looked at quantity and number, there are 95% fewer chemicals. That's where 95% comes from. But that doesn't necessarily mean it means there's fewer chemicals, but what is the impact on lung function? We certainly hear a lot of cases of kids whose athletic ability has been impaired. You can speak to this better than me, through the repeated use of aerosolization and inhalation. We don't know what the effect of repeated inhalation of propylene glycol and vegetable glycerin is over time. So the message is these are not safe. Is it potentially less harmful? That is the discussion. So in order to have this discussion in an informed way, you need to talk about two different populations. And the problem is no one talks about two populations, right? Everybody's screaming at each other. They shouldn't be legal. They should all be legal. And the answer is you guys are talking past each other. You need to look at kids, and then you need to look at adults who are quitting smoking. Only then can you have an informed discussion about true risk. So for adolescents under the age of 25, these are not safe. In fact, if I was king of the world, the way that you solve the addiction crisis is you make any kind of potentially addictive substance illegal to the age of 25 and inaccessible. You would have all your addiction problems solved in 30 years. Because most drug use, 99.9% of all drug use starts before the age of 25. If you can keep a kid away from a potentially addictive substance until the age of 25, the likelihood of ever be addicted after 25 is 0%. That's all during brain development. So there is no safe level of exposure of these products to kids under 25. Now, parents that are dying, and I work in a clinic where I watch my patients die from lung cancer. Could their lives have been saved if they switched to this? I don't recommend these products to my patients, but if you developed a safe product like this that they were willing to use, there is a potential that they could save their lives. But we just don't know, and that's the problem. But we need to think about two different populations.
Absolutely.
Kids, never okay. Adults quitting smoking, different conversation. Not the same conversation.
Absolutely. That's a really good point to bring up. We have an audience question that kind of gets at the propylene
propylene glycol.
PG. Perfect. PG. PGVG. They're asking about, some of those flavored enhanced e-liquids without nicotine, without CBD, without THC. Are those safe to use, or is there still risks?
So, great question. So the studies that they've done is we don't have a lot of human data. Remember, it took us 50 years in the United States from the time that we started smoking cigarettes to the first publication, case control, mind you, 1950 JAMA, showing the association between smoking and lung cancer. It takes a really long time in populations to be clear about the risks. So we don't have any human data. So what they've done in the e-cigarette science is they've taken e-liquid, and they've done two things. They've taken the e-liquid and then the aerosol e-liquid and exposed those to different tissues, like neural tubes or lung fibroblast, and then looked at the cells and see if they die or do well. And they looked at all the chemicals and aerosolized and non. And what they found is that there are very dangerous flavoring elements in these. So for example, one particular flavor called cinnamon Ceylon has cinnamaldehyde in it. Now, cinnamaldehyde is actually very toxic to lung tissue, and it's something that people inhale, and because it's not a regulated industry, flavoring agents can be potentially dangerous. And flavoring agents can actually transform from the chemical that's in the liquid, be heated, and turn into something that's a lot more harmful when it's inhaled. Now, nicotine is not transformed, okay? So nicotine is actually, the risk of nicotine in the e-liquid and aerosol, it doesn't change from that. So all the toxicity studies actually have not shown that nicotine is the causative agent. Most of them have shown that it's either PG, which can actually turn into formaldehyde when heated, or flavoring agents that are either intrinsically harmful or transformed to something harmful when they're heated at 350 degrees Celsius in an e-cigarette.
Okay, thanks. This is mind-blowing stuff. It was very interesting.
Just to support Dr. Ebbert's talk. So what we actually see when kids or young adults or teens they present with cough and shortness of breath, which is due to this, like the lung being irritated by some kind of a chemical. And is also backed by not just symptoms, but also chest x-ray and lung biopsy, which are reflective of acute lung injury. So just going back to my thing, saying that, this is not safe in kids at all.
Agreed.
Whatsoever.
Agreed.
What about, how does the one other misconception is the nicotine levels. The amount of nicotine, you've talked about how the deliveries are different in the aerosolization, but compared to like the pod method, let's take that because we see that being more commonly used amongst teens. Is the nicotine that's being delivered to them going to be comparable, more or less than it would be with conventional cigarettes?
So it's complicated, and so a couple things I would say. With the advent of the Juul and the nicotine salts that are all the rage to use, it's delivering a lot higher concentrations of nicotine than in normal e-liquid. The issue with tobacco smoke as opposed to e-liquid aerosol delivery is that tobacco smoke, when you burn a cigarette and you inhale it, the particle size, the tar, is the right particle size to get delivered to the alveoli. So what's happening is you inhale that burn smoke, nicotine gets delivered very efficiently on the tar particles that goes into the alveoli. Nicotine is absorbed, the tar stays there, pretty much forever, and causes black lung. And then what happens is and what happens with an e-liquid that you aerosolize, some of it gets to the lung, but most of it is just being delivered to the upper airway, mouth and throat, which is a slower absorption than pulmonary delivery. So we talked about before that the addictiveness of any drug is directly related to how quickly you can get it into the central nervous system and in what concentration. Tobacco delivers speed and reasonable concentration, so it's fast with a reasonable concentration. E-liquids actually deliver a lot of nicotine, but it's relatively slower. And so, that has important implications for when we try to regulate the industry and say that you should limit amount of nicotine in e-liquid, because what we need to think about is that the drug that will always win in the room is the drug that delivers the drug the fastest. And that will always be e-cigarettes if you artificially suppress the e-liquid concentrations or the nicotine concentrations of e-liquid. Different conversation, different day, but that's what Europe's trying to do, is put a ceiling on nicotine delivery. The unintended consequence of that is people will shift to smoking, because what happens is when kids are experimenting with drugs, they use drugs and they find the one that gives them the most immediate reinforcement, and they use that drug. And if you suppress e-liquid nicotine concentration, that will always continue to be the smoke cigarette, and then they have a 66% chance of dying from it if they continue to use it lifelong.
Oh my gosh, wow. We're moving towards the end of our time, so so that was a perfect segue. So for the kids that are becoming addicted, if they're continuing to use cigarettes lifelong, there's absolute consequences. But what about these kids that are earlier on that are realizing that they're addicted? What would be some of those signs, and what can we do to help them?
What do you do?
I don't take care of, children who have these issues, but they come to a pulmonologist because they have some kind of lung issues, and I cannot make that causal link, but then there's always this remote history that they had vaped. So I speak to children and say, and then I give all this evidence saying that this is not safe, and then their lungs are still, developing and should not be exposed to all these toxic chemicals, and then I refer them to resources where, usually general pediatricians where to ask for help. And it's also a family thing that parents need to be aware and not be judgmental about their kids, and help and support the kids in with this process.
Yeah, so we don't have a lot of good data on how to help kids quit these products. The anecdotal stories, no evidence, is that there are different nicotine concentrations that you can buy, and that tapering is a treatment that we use when we treat tobacco dependence. We taper. There's also CDC if you want to give your kids information, or that's what we're talking about, there's cdc.gov, NIDA, the National Institutes of Drug Abuse, has good information. Not a lot of, there's good information, but not a lot of proven effective therapies to help kids transition off these products, because it's a new phenomenon where we have kids using nicotine who have never previously used cigarettes. So the same modalities don't necessarily apply.
And the school systems are starting to get more support for kids too as well. There's addiction groups, there's more private groups in town too, where people can go for treatment those are some of the resources I refer to, and we also have, the Nicotine Dependence Center here.
Yep.
So we at Mayo Clinic, and I'm sure other health centers have nicotine dependence consults that you can, or substance abuse consults that you can refer to, where someone as an addiction specialist, such as yourself, can help figure out a plan for these people individually.
Right.
Yeah. Well, as we near the end of our time, do you have anything else to add, or any other resources for families that you would recommend for them?
I will send them to the experts.
Yeah, I think that's fair. I think, in the more, we get a lot of calls from parents, and I think that parents are, asking for support and help and how to, and as you said, I think we were talking before, having conversations with your kids. What are you using? Why are you using? And I think I think the e-cigarette epidemic is really a symptom of a broader malaise that we have in our kids, and it's lack of connection, it's feelings of isolation. We have a self-contained sort of reinforcement system in our head. We don't need extraneous chemicals to feel reinforced, but somehow today kids need that. So what is it that's changing our society? Having those conversations with your kids, difficult conversations about what are you suffering from, what are you trying to treat? Because at the end of the day, we all want to escape pain. And kids that are using these medications at very high levels are trying to escape some kind of pain. I think we need to look at our kids and look in their eyes and figure out what that is.
Absolutely. Yeah. Absolutely. Well, thank you so much for the time that you gave us today and all the information that you've shared. It's been very enlightening. And thank you, Dr. Pillia, as well, for joining us. It's been excellent. Thank you, everyone who watched and sent in questions as well. You can catch the next Ask the Mayo Mom Facebook video question and answer session on February 6th at 11 a.m. Central Standard Time. It'll be about cardiovascular surgery for children with congenital heart disease. We're going to be honored to have two pediatric cardiovascular surgeons who will be joining us for this discussion. The first is Dr. Joseph Duraney, and the second is Dr. David Overman. Thank you, everyone who watched and sent in questions. Have a wonderful day.